One of the oldest known diseases is rabies. It is a highly deadly viral disease that affects mammals, including humans. Rabies is caused by a virus from the Lyssavirus genus. Lyssa is a Greek word which means violent or rage. The term rabies comes from a Latin word meaning madness, which describes the neurological effects seen in infected animals and humans. Rabies kills about 59,000 people across the earth every single year. About 40% of these victims are below the age of 15. Over 95% of these fatalities occur within Africa and Asia. Once the rabies virus enters a host, the virus primarily attacks the central nervous system, leading to inflammation of the brain, a fatal condition known as encephalitis. Rabies is classified as a zoonotic disease, meaning it can be transmitted from animals to humans. It is mostly transmitted through the bite or scratch of an infected animal. In some cases, it can spread through scratches or open wounds exposed to the saliva of an infected animal. The primary carriers of the virus or sources of rabies in humans include dogs, raccoons, skunks, bats, wolves, coyotes, foxes, cats, mongooses, monkeys, and cattle. Dogs are the leading cause of rabies transmission worldwide. About 99% of the global human rabies cases come from domestic dogs, especially in regions of Africa and Asia, where dog vaccination programs are less robust. Stray and unvaccinated dogs are particularly dangerous in these areas. Once the rabies virus enters the body, it initially stays close to the entry point. The virus replicates slowly at the site of the bite or wound, often for several days or even weeks. This is referred to as the incubation period. Bites closer to the head result in a shorter incubation period. The incubation period for rabies can range from 1 week to several months, but on average, it lasts about 1 to 3 months. During this period, the individual does not exhibit any symptoms, but the virus is silently spreading. After the incubation period, the virus attaches itself to the receptors of the peripheral nerves near the bite site and uses the nerve cells as transport, moving away from the site of the infection toward the central nervous system, particularly the brain and the spinal cord. Rabies is unique in a way that it travels within the nerves themselves. It avoids the bloodstream and the immune system for as long as possible, making it difficult for the body's defenses to detect and attack the virus. Once the virus reaches the brain, it multiplies very fast, causing inflammation and damage to brain cells. This is when the first symptoms of rabies start to appear. The initial symptoms can often be non-specific and may resemble those of flu, such as fever, headache, general weakness or discomfort, and itching at the site of the bite. As the virus continues to spread in the brain, more severe neurological symptoms begin to develop. During this stage, the disease enters two major clinical forms: the encephalitic or furious rabies and the paralytic or damp rabies. Furious rabies account for 70 to 80% of rabies cases in humans, and it is associated to hyperactivity, erratic behavior, and hallucinations. Symptoms include hydrophobia, the fear of water, aerophobia, excessive salivation, seizures, and agitation. The furious form of rabies also presents periods of disorientation, leading to a dangerous cycle of confusion and aggression. Paralytic rabies causes muscle weakness, paralysis, and coma. Patients experience a slower progression of the disease, and the paralysis often starts at the site of the bite before progressing through the body. Both forms eventually lead to coma and death without treatment. Rabies is almost fatal once symptoms appear. The patient enters a coma, followed by a cardiac or respiratory arrest. Death typically occurs within 2 to 10 days after the onset of neurological symptoms if the disease is not treated. The rabies vaccination is the most effective method for preventing rabies. There are two primary strategies. The first strategy is pre-exposure prophylaxis. This is administered to individuals at high risk of exposure. The second strategy is post-exposure prophylaxis, which is administered after a potential exposure.